My name is Dr. Vanda McNiven. I'm a clinical geneticist. I currently work at McMaster Children's Hospital in Hamilton, Ontario, Canada. I first learned about Cornelia de Lange Syndrome, CdLS, during my training in genetics residency. During that time, I worked with Dr. Tony Klein, who is an expert working with the population of CdLS. And then throughout my training, as well as now my career as a clinical geneticist, I worked with other individuals who have a diagnosis of CdLS. And I really enjoyed working with this population. And this led me to eventually work with the CdLS Foundation in Canada. In terms of pursuing molecular genetic testing, there are many reasons for this. One, it can confirm a genetic diagnosis for an individual who has a clinical diagnosis of CdLS. It can also identify the specific gene that is involved and the specific type of genetic change that's involved. And sometimes that can give us information to better understand what will this look like for that individual as they get older in terms of types of health implications to be aware of. It also can help us understand how this diagnosis of CdLS can run in the family from the genetic side of things. So is this possibly inherited from a parent, for example, who was otherwise healthy and had no idea that they also had this genetic change? And is there a chance that siblings could also potentially be affected or pass this on to other children? So more just to inform people of what this can look like in the family and how it can be passed on. Another reason that can be really helpful to do genetic testing is that this can really help individuals identify with a community. So for example, with CdLS, and finding that genetic diagnosis can really help connect people with other families, for example. It can also make an individual and their families eligible for research in CdLS in case that's of interest to them. As a clinical geneticist, we are trained in both the clinical side, so the medical side, and we're also trained to be experts in the molecular side. So we unite the clinical role with molecular. In the clinical role, we meet with individuals, so as patients, we do full history taking, medical history taking, family histories, physical exams. And then we unite that with our understanding of the molecular side of things, so genetic testing and helping to interpret those results, and also helping to guide families in terms of what does this mean for that individual with this new diagnosis, but also for other family members. And for parents who are interested in having another child, what could this look like for future pregnancies? It's crucial that we develop our expertise in CdLS in Canada. We have benefited a lot from learning from our colleagues in the US, and they've been fantastic resources and collaborators. But in Canada, we know that we have our own unique needs and our own unique challenges. And forming a collective group that is expert in CdLS will only help further our group, our family of CdLS, both for individuals, patients with this diagnosis, as well as their families, as well as the collective understanding of the medical specialty, which is absolutely crucial to help facilitate the care of individuals with CdLS.